morning, students. Welcome back to our YouTube channel, Dentizzy. Let's make dentistry easy with Dentizzy. Today, we are going to discuss about a very important topic in orthodontics, which is the ugly duckling stage, which is also called as the Broadbent's phenomenon. So, let's get started. As we all know, we study dentition into the two parts. One is the primary dentition, another one is the permanent dentition. Primary dentition is the one in which the teeth shed at the early ages, whereas in the permanent dentition, once the teeth erupt into the oral cavity, they stays forever. They stays forever once they are erupted into the oral cavity. Deciduous dentition begins with the eruption of teeth at the age of 6 months, whereas the permanent dentition, it starts with the eruption of teeth at the 6 years of the age. If we discuss about the nomenclature differs a little bit in both the dentitions, in primary and the permanent dentitions. In primary dentition, it is being named as A, B, C, D, and E, whereas if we discuss in the permanent, it's considered 1, 2, 3, 4, 5, 6, 7. As we all know, in permanent dentition, the premolars are present, which are not there in case of primary dentition. So these are the teeth which erupt into the oral cavity. As we all know, there are the 4 different quadrants in which the teeth erupt. So this is the sequence in which the eruption of teeth takes place in both the right and the left side of the oral cavity. In case of primary, in which the canine erupts later than the tooth number D, which is the primary first molar, right? Whereas in the permanent dentition, it differs both in both the maxillary and mandibular arches. That is, in the maxillary arch, the canine erupts at the later stages, whereas in the mandibular arch, it is being considered to erupt after the lateral incisor only. There is one another dentition period in between the primary and the permanent, which is being called as the mixed dentition period. Now, what happens is after the primary dentition and it starts shedding of its teeth, there is the eruption of the permanent teeth. There is the exchange of teeth between the primary and the permanent dentition. So it is being divided into the 3 phases. One is the first transitional period, intertransitional period, and the second transitional period. We'll discuss about each transitional period in the subsequent videos. Today we'll be discussing about specifically about the eruption of permanent canines, secondary canines, or the permanent canines. That what happens when the canines they erupt into the oral cavity. If we look at this diagram, in which I have represented the teeth in the oral cavity. This is the midline, which is demarcated between the left and the right side of the oral cavity. This is number 1, central incisor, lateral incisor, and these are the erupting canines. As we all know from the morphology, that this is the crown portion of the tooth and this one is the root portion of the tooth, right? Now, in this diagram, once the teeth specifically canines, when they start to erupt into the oral cavity, the crown portion of the canines, they start to apply some pressure on the roots of the lateral incisors. As you can see in this diagram, the crown portion is being putting on and pressure on the roots of the lateral incisors, and which leads to the tipping movement in both the central and the lateral incisors. Once the force is transmitted to the lateral incisors, it will transmit the certain subsequent forces to the central incisor as well. In this, the displacement is seen. The roots, they are tipped towards midline, and hence the crown portion, they move away from each other, hence creating a midline diastema. Temporarily, this is the situation in which the midline diastema is being created between the crown portions of the tooth. This situation is temporary. This situation is temporary and which is being corrected on its own after the eruption of the permanent canines. Once the canines are being erupted into the oral cavity, it will start the pressure on the roots of the lateral incisors and the central incisors, it will shed off, and the crowns will erupt into the oral cavity, and hence the midline diastema will be closed on its own. Since this is a kind of malocclusion which corrects itself on its own, that is why this is also called as a self-correcting malocclusion. This is also called as the midline diastema, self-correcting malocclusion, and the transient malocclusion. The whole phenomenon which we have studied in this video is called as the broadbent's phenomenon, or also called as the ugly duckling stage. Now, as we know, as the teeth erupt into the oral cavity at a certain set of age, this occurs between 7 to 11 years of the age, because this is the time during which the canines erupt into the oral cavity. Few references are there which describe this to be between the 8 and 9 years of the age. Now the question may juggle your mind that why it is being called as a ugly duckling stage. The reason behind it that when the midline diastema occurs in the children, it looks like the duck face, which is very ugly. The patients or the parents, they bring their child to the clinic with the complaints that they don't look nice and there is a unwanted space between the teeth at this particular age. So we need not to bother about it, we need not to worry about it. That is the stage which will correct on its own, and hence it is called as transient malocclusion. So this was all about ugly duckling stage. If you like the video, like and share and subscribe. Thank you. Stay tuned.